In 2019, the New South Wales Ministry of Health engaged URBIS to conduct an external evaluation of the Youth Community Living Support Services Program, Y-Class. This program supports vulnerable young people recovering from serious mental illness in the community. Findings of the URBIS evaluation have been invaluable. They were used to extend these vital services through the height of the pandemic in New South Wales, and the final report is now supporting our proposal to continue the program for a further 5 years. The recommendations brought to light areas for improvement, and we are now refining the model of care and data requirements. These elements will strengthen the program as we move forward. Y-Class forms part of New South Wales mental health reform. The evaluation highlighted critical success factors that set the program apart, and it demonstrated positive outcomes for young people, their families, and the health system. Importantly, the URBIS evaluation demonstrated that mental health reform is on track in New South Wales. Thank you.
City of Parramatta Council's Socially Sustainable Parramatta Framework is a strategy to help us put people first and ensure our community is resilient. It distills down into an overarching objective of sharing the benefits of growth with all, and 8 goals that, when achieved, mean that our community is socially sustainable for everyone. For example, children are our future.
We engaged a consultant to coach us in developing an indicator framework to measure our progress towards these goals. We spent 6 months using theory of change methodology to land on a selection of indicators for each goal.
So why is this considered innovative and demonstrate excellence? Social sustainability in local government is often talked about but rarely measured because it's inherently complex. We've been able to achieve this with agreement from over 40 internal business units. We've developed an indicator matrix that makes the complex simple and accessible. They measure impact for people and the city and council. Importantly, the indicators position Parramatta's social change as everyone's responsibility and are designed to be used by the city stakeholders too. We didn't just pay people, we engaged experts as coaches to build our capacity as staff to do quality impact measurement into the future. And that's what we intend to keep doing here at City of Parramatta. Thanks for this opportunity.
With the New South Wales Department of Communities and Justice moving from a contracting to commissioning approach, reforms or changes to processes and systems, funded service providers were required to transition from compliance to continuous improvement underpinned by local evidence. Of course, this came with a new government reporting system. FAMS, as the peak body for targeted earlier intervention, undertook to develop training to support transition. Workshops were designed to prepare workers to collect and record their data differently. It was necessary for almost 600 funded services to become proficient in outcomes data. Previously, output data was recorded in various platforms, so the changes to database and dataset required the workforce to upskill. The outcomes data will assist workers and the department ensure the services provided meet the emerging needs of children, young people, families, and communities. FAMS workshops led the transition to high quality and consistent outcomes data across prevention and early intervention services in New South Wales.